What I remember was that it was a beautiful day. It was sunny. We were standing outside talking, and all of a sudden I got this excruciating pain in my chest. And my boss immediately said, "You need me to call 911?" I said, no. I said, "I'm going to try to walk it off." I realized that the pain was starting to subside a little bit, yet I couldn't breathe. And that's when I said, no, okay, you know what, call.
I was at work in Manhattan. I received a call, and it was my husband's boss. And he said, "We just put George into an ambulance, and we're pretty sure he's having a heart attack." And then he told me he was going to Valley.
I honestly don't remember anything from there until when Dr. Grau came in, and he said to me, "You didn't have a heart attack." And I was like, "Oh, good." And then he said, "No, it's not good. You have had an aortic dissection." I said, "Okay." He goes, "We need to take you into surgery." And I said, "Well, let me think about this." He's like, "There's no time to think."
About 4 hours went by. Kim, the nurse practitioner, came to chat with us just to let us know, everything was pretty much going as planned. And then about an hour after she came, someone came out and he said, "We're doing everything we can, but he's bleeding profusely, and we don't know if we could stop the bleeding by some miracle." And they used the word a lot. Even the doctors were using the word miracle. He had survived. About an hour later, we saw Dr. Grau, and he brought us in to see George, who was just covered in wires. And I mean, there were wires that you couldn't even tell where they were going. There were so many. The next day they came and did a CAT scan, and we met with Dr. Sitak, who is his neurologist, who then broke the news that he did have several large strokes. They didn't know if he'd be able to move his left side at all. And the other large stroke was in the region that affects your vision. So they didn't know if he'd be able to see. Within a week later, they had him walking around the unit. And from there, he went on to a rehab facility for another few weeks.
The occupational therapist asked me, "Show me a picture of a color green." And she said, "You know what color this is?" I said, "No." 1 + 1. I said, "No." And then I started crying. She goes, "What's the matter?" I said, "I used to do payroll at my job. And if I can't add those numbers, I can't work." And I just started crying. She goes, "Listen, if you remember that, you're going to be okay."
When we saw his neurologist, maybe 2 months after his dissection, he couldn't believe that he was standing there and walking and talking. From my perspective, he's doing great, but of course, the patient always has their struggles.
I did lose my vision partially. I do have vision loss down to the bottom left and to the top right. And my arm moves a little bit weak, but I move. I'm actually running and exercising, which I wasn't able to do. But no, I feel fantastic.
As far as the surgeons, the nurses, I cannot explain in words how wonderful they are. They are truly, truly special people.
The fact that everyone takes their time with you. There's no rush. There's no, we know more than you, just don't ask questions. There's none of that here. Everybody here treats you just like family. Everybody here gives you a hug when they see you.
The caring is real here. You could feel it, and you could feel it here at Valley.